Everyone, it's Bear. It is Saturday, June 11th, 2022, and I wanted to share some things around a situation that's been unfolding in Texas for the last couple months. I didn't want to respond to this right away because I didn't know that much about the case. I'm always late on videos, and I just wanted to see where it went. So the news broke earlier today, last night, that a district judge in Texas has ordered the state to suspend child abuse investigations against three families with transgender children who sued Governor Greg Abbott earlier this week. I'm reading from a CNN article, I'll link it. The judge said that the investigations can cause immediate and irreparable injury, including gross invasions of privacy in the home and school, and the resulting trauma felt by parents, siblings, and other household members, as well as negative impacts on grade and school activity, fear and anxiety, and increased incidence of depression. This happened, the investigations we're talking about, carried out by the Texas Department of Family and Protective Services, DFPS, come after State Attorney General Ken Paxton released a non-legally binding opinion earlier this year declaring providing gender-affirming surgical procedures and drugs affecting puberty should be considered child abuse. And so what happened is then the Department of Family and Protective Services in Texas started opening up investigations on families that were providing their transgender children medical care. And so that has been stopped as of yesterday because it causes all of these issues. It also causes, it opens up the opportunity for teachers and other families to report people who are providing care for their transgender children. And when you're turning people on each other for, each other's personal lives, nothing good comes from that. All right, and there have been societies that have done that before. Hey, come tell the authorities about these kinds of people if you know about those kinds of people. Come tell us, and we'll go after them. So that's what was happening here, and good on Texas, and right in the middle of Pride Month to stop an unbelievably unnecessary, horrible activity. Since this opened up, families with trans kids and queer kids have been leaving Texas in droves. And this is not the only anti-trans thing in Texas, by the way. This is just one of many. But people have actually been getting their kids out because it started affecting not only their trans kids who are already at high risk, but the rest of the family. And like I said, this is a very slippery slope that we started to go down, and I'm really happy to see that it stopped, and I hope that it stays stopped, and we don't see just a huge back and forth now. But more so to responding to this breaking news, I wanted to respond to the responses to this breaking news because it's the internet, and people get all riled up about what they think is going on, but they actually don't know what they're talking about. So for the people out there that are saying like, oh my God, what 4 and 5-year-old needs irreparable, unchangeable surgery on their body to correct their genitals because they think they identify as blank. That's not a thing. That's not a thing. Go do your homework. Go look it up and tell me when a trans child's genitals or body was actually operated on. It's not a thing because their body hasn't developed to that point yet. You want to know who that does happen to, and has happened for decades, possibly longer, is intersex children. All right, intersex is the condition where a person is born with they're ambiguously not fitting into the male or the female sex characteristics. All right, so what that means in short, without tap dancing around it, is some children are born with a penis and a vaginal opening, or they're born with what look like female genitals but also kind of like a bigger clitoris than you might expect, so it's kind of like a small penis. Other things present themselves later where a child might have external sex characteristics that look quote unquote normal or binary, but then they have an internal difference, like internal ovaries in the case of a male, etc. Those kids have suffered decades of non consensual surgeries. All right, and these surgeries can be performed as young as days, weeks, and months old. So you want to talk about like not being able to make your own decisions? That's a child that doesn't even understand that they had surgery. They find out years later when their body doesn't develop exactly like their peers. Then they find out, oh yeah, you were born like this and we had this surgery done on you. And a lot of times those surgeries are incredibly damaging. But it's not happening to trans kids. All right? What happens with trans kids is when you're old enough to understand gender and gender roles in society and how boys are expected to look and dress and act and etc., kids will say, well, yeah, but I feel like that. And what these supportive families are doing is they're allowing their kids to present like that. So, for instance, I was probably 4 or 5 years old when I started saying I'm a boy. This is back in the 80s. All right? In the 80s, people didn't understand what trans was. And so I don't really fault the adults in my life for not following up and getting me transgender health care. It didn't exist then. All right? So adults in my life just tried to coach me and tried to be like, okay, well, you can play with that, you can dress like that, except in this formal occasion, right? I don't fault them for that too much. There were a couple of points where people went a little too far. But in the case of a child who hasn't hit puberty yet, kids are, they don't, oh, what am I trying to think of? They socially transition is what I'm trying to say. They don't go and have medical intervention, and especially surgical intervention. All right. You'll let your kid who identifies as a boy get a short haircut and wear boys' clothes. You know, if they want to go to a formal event, maybe they'll wear pants and a collared shirt and a tie. Or in the case of kids that identify more as female, they'll wear something that makes them more comfortable along that route. Or kids that are kind of in between, non-binary kids. Non-binary identities are a valid thing. And people might want to play with how they present or what their pronouns and their names are. That is a social transition. Before puberty, we are not messing with any kids' actual bodies or how they function. What we do provide them is education and therapy and support. And like I said, allowing them to socially transition. So taking your kid who says, I identify as this, taking them to a counselor and sitting down with a family counselor and asking that counselor, how do I support my kid? Or to sit with the kid and say, like, you know, you feel like this, do you feel like that? And working with them and trying to figure out how they identify. And then supporting them in their life, which is really difficult. Because kids who are different have difficult lives. All right? Everyone treats them differently. Their classmates, their teachers, bullies in school, and bullies at home treat trans kids differently. So that may not be the parents, but it might be the grandparents, it might be an aunt or an uncle who sits there and like treats your trans kid like crap and bullies them. Bullies exist everywhere. Therapy and that kind of medical intervention for a trans kid is only stopping them from experiencing the things that I just listed, like depression and problems with their grades and the incidence of self-harm and suicide attempts. Sitting there and saying that your family is under investigation for supporting your kid is only going to drive those numbers up. We already have a 40% rate of kids, queer kids and trans kids, who attempt or are successful at the act of suicide. Investigating their families for helping them is not going to lower that number. Who in their right mind thinks that that's gonna work? Or that it's not gonna just create a really confused child and then later on a really confused, unhappy adult? When it comes to medical intervention and actually changing a trans person's body, yes, we do provide puberty blockers and that is not when a child is so young that they just might be confused. All right, not that I think trans kids are ever just confused, but kids go through phases, they explore, whatever. When it comes to puberty, you're talking about a preteen or a teenager that's starting to go through puberty and has already probably talked about how they don't really identify with their assigned sex at birth. And now their body is starting to change, and it's against their will, and it's incredibly upsetting. In that case, we are providing puberty blockers for those kids, and that is not a permanent thing. So again, this argument of like permanently altering children's bodies, puberty blockers are not permanent. If a kid goes on puberty blockers because they don't like how things are developing, they can stop, and all that happens is puberty starts a little bit later. Delayed puberty is not the worst thing in the world. I went through super early puberty. I started puberty at like 9 or 10 years old. I got my first period when I was 11. I started developing breasts really early on, and it was awful for me. And as a result of early puberty, I'm 5'2". I actually stopped maturing earlier. So maybe if I had gone on puberty blockers, I would have actually grown a little bit taller, and I would have a little less like around that factor in my life. But I digress. It would have at least stopped puberty long enough for me to kind of figure out, do I want to go through male puberty? Do I identify as male? Do I want to live a male life? Do I want to kind of live more in the non-binary aspect where things can be dealt with low-level hormones or no hormones and just social differences, like I want to use neopronouns or they-them pronouns instead of he, him, she, her. It just gives kids a little space to breathe and to figure life out. Man, if adults had space to breathe and to figure life out, our lives would be a lot different. There would be a lot less problems in the world. But let's give kids that chance. Why is that a bad thing or a wrong thing? And in my case, again, if I had gone on puberty blockers and delayed puberty and then just started testosterone later in life when I could really make those decisions, because that's what we're talking about, I would have just gone through male puberty. All right? And I would not have had to have corrective surgery, or I would not have had as invasive of a surgery. So for those who have followed my channel, I had top surgery in 2015. I had my breasts cut off to make my body feel more comfortable for me and to be able to live and pass comfortably as male. My breasts on a 5'2" frame were C to D size breasts. They were large and they were painful. All right, they were painful because I had fibrocystic breast tissue. But I had to have major surgery to get them removed. That surgery may not have been as invasive and major had I not developed that much of a female body in the first place. That's what we are talking about when we medically intervene. We're not doing surgery, and we're not doing hormones on 5 and 6-year-olds. No 5 and 6-year-old have pubescent hormones in their body. That's not true. There is precocious puberty, but that's a different story. But yeah, kids who are different go through enough trouble as it is. They're bullied, they're fighting their own reality and wondering, what's wrong with me? Why don't I just function in the world like the majority of my peers? And that can be a horrible place to be, and a lot of kids go through a lot of trauma. If we can ease that a little bit, how is that child abuse? It doesn't make sense. So, right on, Texas. Happy Pride. Thank you for taking the right steps to intervene with actions that were just absolutely wrong. I really hope that we keep going in this direction, and I hope that the families that were involved in this or were at fear for this happening to them, I hope that you're safe. I hope that you're well. And thank you for supporting your trans kids. Thank you to teachers who don't turn in their trans and queer kids in these states that are like asking you to do so. Thank you for taking care of people who are already at risk and in danger. and happy Pride, and thanks for listening.